Welcome. You have been invited to participate in an international research project which aims to establish the rationale physicians offer in response to written questions probing clinical reasoning under conditions of uncertainty. We are using a modified version of the script concordance test, and in this short presentation we will go over the basic methodology with you. The format of the script concordance test is shown here. There are three types of questions: those that assess a diagnosis, an investigation, or a plan of management. Every question follows the format shown. There is a case scenario, a suggested diagnosis, investigation or plan of management, and new information to consider. As is the case in clinical practice, the data are always incomplete. You are asked to consider the effect of the new information by selecting your preferred response from the 5 options provided. What has been described is the standard script concordance test. There is no correct answer. Experience indicates that clinicians will provide a range of answers, but usually with a clear modal response. In this research we are seeking to learn what clinicians are thinking when coming to their answer. To achieve this aim, we are asking you to explain why you chose your answer, and to indicate if you checked a reference and/or with the person before making your decision. Let's have a look at an example. This question requires a decision about the utility of an investigation, blood cultures, in a patient with a febrile illness and respiratory symptoms, who has been on an antibiotic for a week. You are asked to determine if the new information, that is, the use of the antibiotic, has any bearing on the utility of blood cultures in this scenario. There is no correct answer. What is provided here is for illustrative purposes only. This research is undertaken online, using a SurveyMonkey questionnaire. If you choose to participate, we will provide you with the link. Your participation is anonymous. You are able to go back to the questionnaire and change your answers until final submission, but if you access the questionnaire in multiple sittings you must do so from the same computer, as SurveyMonkey recognizes the IP address. This means that participants can't share the same computer. The investigators would like to thank you for your time and interest. If you have any questions about this research, please contact your local investigator.